The steps we need to know in primary survey is DRABC: danger, response, airway, breathing, and circulation. First, you need to check for danger if it's safe for you to approach. As you approach, ask them questions to try to get a response. If they not alert and do not respond to your voice, kneel beside them and gently shake their shoulders. If still there no response, pinch their earlobe. If they're unresponsive, we need to check the airway. Open the airway by putting one hand to the head and gently push the head back and put 2 fingers on the chin. Now, we need to check if they're breathing normally. We do this by putting our ear and cheek to the nose and mouth, looking the body for no longer than 10 seconds. If the casualty is not breathing normally, call for help and begin CPR with chest compression. If the casualty is breathing normally, check the circulation. Any severe bleeding, check on the body. If you find any bleeding, try to control the bleeding and call for help and continue to treat the casualty. That is all for the demonstration of primary survey.
If you think an adult or child is choking, ask them, "Are you choking?" Cough it out. If they are unable to speak or cough, they need your help straight away. If coughing doesn't work, slap it out. Support their upper body with one hand and help them. Use the left of your hand to give up to 5 sharp back blows between their shoulder blades. Then check to see if there's anything in their mouth. If there is, tell them to pick it out. If back blows doesn't work, try giving up to 5 abdominal thrusts. Squeeze it out to give abdominal thrust. Stand behind them. Put your arm around them and link your hand between their tummy button and bottom of their chest. Clench your lower hands in a fist. Grasp your fist with your other hand and pull sharply inwards and upwards. Check their mouth. If they are still choking, call for emergency help.
Minor burn isn't an emergency. Minor burns may involve superficial redness, blistering over a small area, or mild pain similar to a sunburn. To treat minor burn, first you have to gently remove rings or other tight items from the burned area quickly before the area swells. Hold the burned area under cool running water for 10 to 15 minutes or until the pain subsides. You could also apply a clean towel dampened with cool tap water. Don't use ice, gels, or creams as this could damage the tissue and increase the risk of infection. Never burst any blister which may have formed as this may increase the risk of infection. Cover it with a non-stick gauze bandage and this will provide good burn coverage. So remember, when treating burns, move the casualty away from the heat source. Place the burn under cool running water for at least 10 minutes. If it's larger than their hand, a deep burn, the burn is on the face, the hands, or feet, call 143 or 911 for emergency help.
Check if the surrounding is safe. Tap on the shoulders and ask loudly. Ask someone to call 911. Check the pulse. Check if the breathing and circulation is not present. Perform 5 cycles of CPR. After the CPR, check the breathing and circulation. If the victim has signs of circulation but still breathless, perform 2 rescue breaths. Check the breathing and circulation again. Repeat the necessary steps until the person has revived or the medical assistance has arrived.
Heart attacks are serious, and performing these first aid steps could help to save someone's life. What to do when someone is having a heart attack? First, call EMS and tell them your location. Second, help the patient into a comfortable position. The best position would be half-sitting position. Support the head and shoulders, and put a leverage under the person's knees. Third, if the patient is conscious, saying he has medicine with him, let him take it. If there are people in your surroundings, tell them to give space for the victim, for proper ventilation and easy breathing for the patient. In some cases that the patient is not responding and not breathing, perform CPR and wait for the emergency response. Feel the pulse, and if there is not a pulse, repeat CPR.